All right, let's talk about what you need to know for the INBDE exam. Hello, everyone. Welcome to another episode of the MDI Prep INBDE podcast, where we share actual topics that have appeared on the exam. And as always, remember, these brief podcasts are just to introduce you to what appears on the exam, and it's not intended to replace an actual study program. So for a complete live online course, if you want to actually learn online, receive a 90% pass rate, you can visit us at MDI Prep Online. That's at www.mdiprep.online, or you can call us at 1-888-827-9881. All right. So today we have a topic that has appeared on at least 90% of the INBDE exams, and it's a very unique pathology that's more associated with microbiology. Now, this topic that I'm talking about today is called impetigo. Now, before I get into the actual INBDE question, let's kind of go back a little bit and talk about, the little background about impetigo. So when I was 6 years old, my parents noticed these brown honey-crusted sores like on my lower legs, my arm, and even around my mouth. And they really got concerned. Now, you got to consider back then when I was growing up, our parents didn't take us to doctors unless something was actually broken or falling off. And so when they saw these honey-crusted lesions, these sores, they figured, hey, it's not that big a deal. And the thing about it, they really looked really bad. They appeared like they'd be oozing with fluid. Every day something was coming out of these sores. And when I would wake up in the morning, my socks and even the bed covers would be stuck to my legs. So that's how bad it was. Now, at the time, I didn't know exactly what it was, but I knew it was very embarrassing to go outside around my friends. So what my dad decided to do in his infinite wisdom is he figured he would take me to a local beach and he would let me sit in the salt water for about an hour. And he did that. Well, guess what? In about a week, these lesions started to disappear. And within 2 weeks, they were actually gone. Now, does that mean my dad miraculously found a new cure to impetigo? No. That's not. And just a disclaimer, that doesn't mean salt water is the cure for impetigo, because it's not. It just turns out that if you leave impetigo untreated, sooner or later, within about 2 to 3 weeks, it's going to go away on its own. Now, it could have some complications to it, but first of all, we got to give kudos to my dad for trying something. So now let's jump right into the INBDE exam. So let's talk about what you need to know on the INBDE exam regarding impetigo. Now, anyone who's taken our MDI Prep class knows that we love to use mnemonics, easy ways to remember topics. And so today, our mnemonic for impetigo is actually impetigo. You spell the word impetigo, I-M-P-E-T-I-G-O. Those letters we're going to use in order to describe what you need to know for the impetigo. So first, the I. That I means infection. So impetigo is actually caused by a microbial infection. So it's actually normally caused by either Staph aureus or Strep pyogenes. Both of those are what we call gram-positive organisms. And if you want a complete understanding of microbiology and how to identify the organisms, be sure to join the MDI Prep class. So the I in impetigo is infection. The M in impetigo is more kids, more chances of getting it. Let me repeat that. More kids, more chances of getting it. So that means that impetigo is typically seen in like daycare, schools, things where you have a lot of children, typically ages anywhere from 2 years old up until about 7 or 8 years old. The P in impetigo stands for pyogenes, Strep pyogenes. Strep pyogenes is what we call a gram-positive organism. It is what we call catalase negative. That's important because when you're identifying bacteria on the exam, you want to know the difference between catalase positive and catalase negative organisms. So catalase negative are typically going to be your strep species. The E in impetigo is what's affected. That's the epidermis, the superficial epidermis. So your epidermis, the skin, is what's actually affected. The T, this is important. Touch can spread the infection. So how is the infection spread? By touch or contact. The I in impetigo is immunodeficient individuals are at a greater risk. So individuals who may have had, say, diabetes or some type of other immunodeficiencies are at a greater risk for developing impetigo. The G is glomerular nephritis, can develop if left untreated. So typically, like we said, in about 2 to 3 weeks, if you leave the impetigo untreated, it'll typically go away. But one of the complications that could happen, but it doesn't always happen, is what we call post-streptococcal glomerular nephritis. Basically, a kidney infection can develop if the impetigo is untreated. The O, how do we treat it? So oral antibiotics like cephalexin. Cephalexin is what we call a first-generation cephalosporin. And on the exam, sometimes they will ask you about the different types of antibiotics and their mechanisms of action. So make sure that's an important topic for the test. Make sure that any antibiotic or any drug that you look at on the INBDE exam, you understand a few things. 1, what do you use it for? 2, the mechanism of action. 3, are there any side effects? And 4, are there any drug-drug interactions? So those are things to remember. All right, now for the actual INBDE test question related to the INBDE. Can I get a drum roll, please? All right, the actual question that has appeared on the exam is, what is the method of transmission for impetigo? Now, answer choices could be contact, saliva, blood, or an insect. Now, the one with insect could be a little tricky because mosquitoes, basically if a mosquito causes a break in the skin, it could make the individual more susceptible to developing impetigo because of that break in the skin. However, that's not the question. It says, what's the method of transmission? And so the answer for the exam is going to be contact. So typically anything with contact sports, anything dealing with contact, that is going to be the answer for the exam. So I hope this was helpful. I hope this helped you understand at least how they're going to present the impetigo question on the exam. And be sure to tune in to our next podcast, be coming soon, where we have some great information coming about oral pathology that you do not want to miss. So until next time, be sure if you need a class, visit us at www.mdiprep.online. And remember, no matter what happens, you got this.